Amyloidosis. Amyloidosis is termed to be a group of diseases which are characterized by deposition of extracellular substance such as known as the proteins which have not been dissolved completely by a mechanism known as proteolysis, because of which these proteins they get accumulated in the extracellular spaces and result in a disorder known as amyloidosis. So these amyloidosis they are usually they are characterized with a few characters such as they consist of numerous proteins which are structurally and morphologically they resemble each other, but biochemically there is a composition which differs from one another. And among them, starting with the types of amyloids, based on the physical and chemical nature of amyloid, we see that they are made up of fibril proteins which constitute 95% of the amyloid. And the remaining is made up of non-fibrillar component, whereas 5% it is made up of the amyloid P component, which is a constituent which is present in all the types of amyloid. Coming to the fibril proteins, among them AL is a type of protein. It is so termed as abbreviated as AL because it is being derived from the light chain of the immunoglobulin. That is, immunoglobulin consists of lambda as well as kappa light chains. Among them, this amyloid associated with this light chain of the immunoglobulin consists more of the lambda part of the light chain than compared to that of the kappa. And this AL type of protein, it is usually seen associated with numerous dyscrasiases which are associated with the immunoglobulin synthesis. Among them, we see plasma cell dyscrasiasis as well as multiple myeloma. All others show the presence of this AL type of protein deposition, and it is mostly seen in primary systemic amyloidosis. Coming to the next fibril protein, it is the AA amyloid protein. It is so called AA amyloid protein because it is mostly derived, this AA type of protein, it is being derived from the amyloid associated protein which is present in the serum, that is SAA protein. So this serum associated amyloid protein is being abbreviated as SAA protein. So this AA protein is being derived from serum amyloid associated protein, and this serum amyloid associated protein is mostly seen in secondary type of amyloidosis. So coming to another group of proteins, they are the transthyretin. Transthyretin is also a protein which is present in serum, and it is usually synthesized in the liver. And major function of this transthyretin, it helps in the transport of the thyroxine as well as retinol component. So this transthyretin, it is mostly usually seen since it's a protein and made up of numerous amino acids. So any kind of substitution in this amino acid group might result in the mutation of this transthyretin and result in certain group of disease of amyloidosis known as heredofamilial amyloidosis. Since it's as a term itself suggests us, it's a heredofamilial amyloidosis. That means it is being passed from generation to generation. It is not an amyloidosis which is being acquired in nature, but rather it is an inherited amyloidosis where we see it is being passed from family to family, and this is because of the mutation which is occurring in transthyretin protein. So this is one of a protein which is a group of among the fibril proteins. Coming to the A beta 2 microglobulin, it is usually a this protein it is being derived from the major histocompatibility complex which is a part of a host immune system, and this beta 2 microglobulin, it is usually consists of a beta. It is this structurally it has a beta pleated sheath, and most commonly it is seen in either in localized amyloidosis or otherwise in systemic amyloidosis. Next, coming to another group of protein, it is a beta amyloid protein, and this beta amyloid protein we see that this protein is being derived from the broad beta precursor amyloid protein which is usually present in the body, and this is also being associated with certain groups of amyloidosis. Next, coming to another protein of the fibril protein group, it is the immunoglobulin heavy chain amyloid, and this immunoglobulin heavy chain amyloid, as the name itself suggests, it is being derived from the heavy chains of the immunoglobulin, and it is also being associated with localized as well as systemic type of amyloidosis, and sometimes also seen resulting in heredofamilial amyloidosis. Coming to another group of proteins, they are the amyloids which have been derived from the hormone precursor proteins. That is, they are being derived from the precursor hormones groups. That is, such as prolactin, lactoferrin. These are the hormones which result in the formation of this amyloid from this hormone precursor proteins. Coming to the next group of proteins, they are the amyloid of prion proteins. That is, they are being derived from the prions. Prions are nothing but They are infectious particles which lack the DNA or the RNA material, and this gives rise to the amyloid protein, and most commonly it is seen associated with certain infectious diseases. And coming to another group of components of the amyloid proteins, they are the non-fibrillar proteins. Among them, amyloid P is one of them, which is usually seen in all forms of amyloidosis. It can be seen, and the other one is apolipoprotein E, which is usually it helps in metabolism of the lipoproteins, and this is also one of the non-fibrillar component of the amyloid. And next coming is the sulfonylated glycosamine glycans. It is usually one of a matrix constituent which is usually involved, and it is also one of the non-fibrillar amyloid protein. And next coming is the alpha anti-chymotrypsin. This is also one of the non-fibrillar component which can be seen associated with amyloidosis cases. And protein X, it is seen usually in conditions such as prianosis. Prianosis is usually it is a group of conditions which is characterized by neurodegenerative disorders, which consists of prions, that is infectious pathogens, which differ from that of the viruses, fungi, as well as from the bacterial species. So these are certain physical and chemical natures of amyloid. So since amyloid it is basically because of the abnormality in the protein deposition. So any abnormality in this protein deposition or otherwise in the form structure of the protein might result in this disease known as amyloidosis, which is a protein deposition disorder. Coming to the types of amyloidosis, it is a light chain AL amyloidosis. It is most commonly seen in the conditions which have show the abnormality in the synthesis of the immunoglobulin. Since when in certain conditions such as monoclonal gammopathy, where we see there's abnormal increased secretion of the immunoglobulins can be seen, and such type of conditions we can see they can be associated either with the abnormalities in the plasma cells or otherwise in the immunoglobulins, and this type of conditions can be seen in multiple myeloma as well as in plasma cell dyscrasiasis, and as well as in B cell lymphoma. Can be given a few illustrations of this light chain amyloidosis, which is a primary systemic amyloidosis. And the other type of amyloidosis, it is the autoimmune amyloidosis, which is also known as secondary amyloidosis. It is most commonly autoimmune because of the formation of autoantibodies against to this amyloid proteins, and mostly we see that this AA amyloid protein, as already discussed in the physical and chemical nature of amyloid, that this is being derived from the serum amyloid associated protein. So any abnormality in the serum amyloid associated protein can result in abnormality or mutations in the consequent proteins and cause this autoimmune amyloidosis. The next coming to another group of amyloidosis, it is a heredofamilial amyloidosis, and so it is hereditary, so it is being carried from generations to generations, that is from the parents to the offspring. And the most commonly involved organs which are being affected with this kind of amyloidosis is the central nervous system as well as the eye. We see that there are several abnormalities which are being affected, and it in complicated cases or long-standing cases you can see even cardiomyopathies, that is any diseases relating to the cardiac system or the heart can also be affected. So these are certain types of amyloidosis, that is a primary, secondary amyloidosis and the heredofamilial amyloidosis. So coming to the classification of amyloidosis, based on the category, they can be classified majorly broadly into systemic amyloidosis and localized amyloidosis. Among the systemic amyloidosis, we see it is a primary amyloidosis, which we see it is mostly associated with the plasma cell dyscrasiasis, and usually the biochemical type, that is a protein type, we find is fibrillar protein. It is the AL type protein, and the organs which are most commonly involved in this type of primary systemic amyloidosis, they are the bowels, skin, nerves, as well as a heart. So these are few organs which are being affected. Next, coming to the secondary systemic amyloidosis, it is most commonly seen associated with long-standing cases such as in chronic inflammation or otherwise in cancers, and the major protein here we see is it is the AA type of amyloid protein, and the organs which are being infected here mostly affected are liver and spleen. Coming to another type of systemic or generalized amyloidosis, it is a heredofamilial amyloidosis, and usually it is seen associated with chronic renal failure, since kidneys are being associated with the filtration of these proteins in the glomerular as well as in the tubular part. So any abnormalities can result in filtration part can result is most commonly associated with chronic renal failure. So heredofamilial can be associated with this chronic renal failure, and the protein, it is the alpha beta 2 macroglobulin, which is a protein, fibrillar protein, which is being associated with this type of amyloidosis. And most commonly involved organs, it could be the synovium, joints, or the tendon sheaths. So coming to among the heredofamilial, we also see certain other three types, that is the hereditary polyneuropathies can be seen, or familial Mediterranean fever can be seen associated, or there are certain rare hereditary forms can also be seen associated with this. Coming to the localized type of amyloidosis, among them we see that it is localized, that is it is particular only to one organ. So among them we can see it could be affect the cardiac system, cerebral system, endocrine system, or otherwise it could be tumor forming system. If suppose it is being associated with the cardiac system, then it is known as senile cardiac, and the associated protein or abnormality seen associated with the ATTR, that is a abnormality in the amyloid associated transthyretin protein. This is what we see the abnormality in this kind of fibrillar protein, and the organ affected is, as a term itself suggests, senile cardiac. It means it affects the heart. The next coming is the senile cerebral system. It is most commonly seen associated with the disorders which are being affected with that of the brain. Among them it could be any kind of encephalopathy, or otherwise Alzheimer's could also be one of the illustration. And the proteins which are being affected, they are the amyloid beta protein, as well as even the prion proteins. They can also be associated with this. And the most commonly involved area within the brain, it could be the cerebral vessels, or otherwise it could also be any neurofibrillar tangles can also be associated with this kind of localized amyloidosis in senile cerebral part. Endocrine, coming to the endocrine type of localized amyloidosis, it is mostly seen associated with the amyloid proteins which have been derived from the precursor hormone proteins. They could be from the procalcitonin, or otherwise from the proinsulin, which are the precursors of insulin and calcitonin. And most commonly it is being associated with the disease known as medullary carcinoma or type 2 diabetes mellitus. And usually we see, since the name itself suggests, it is being from the hormonal glands, that is the hormone secreting glands such as thyroid gland, or otherwise the islet of Langerhans. These are the structures which are most commonly affected because of the localized amyloidosis associated with the endocrine system. Next, coming to the tumor forming, usually we see it is usually associated with the tumors derived from the or occurring in the lungs, or otherwise from the larynx or the skin, and usually it is of AL type of amyloid protein which is showing any abnormality. And usually we see that it might manifest as based on the respective anatomical location, these diseases might manifest. So there is a classification of amyloidosis. The next, coming to the major differences between the primary amyloidosis and the secondary amyloidosis. Based on the biochemical composition, they can be classified. Primary amyloidosis, we usually see it as being associated with any abnormalities in the AL, that is the light chain associated amyloid proteins, most commonly the lambda chain when compared to that of the kappa. And usually when we see in the secondary amyloid, it is the AA protein which is most commonly associated, and this protein is usually derived from the serum amyloid associated protein. And coming to the diseases which are being associated in AL type, usually you see the disease, it is a plasma cell dyscrasiasis, or the multiple myeloma, or the B cell lymphoma. These are the diseases most commonly being affected. Whereas in the AA type of amyloidosis, we see the long-standing cases such as chronic inflammation or infections such as TB or primary osteomyelitis can be seen affected. Coming to the pathogenesis, why AL amyloidosis or the primary amyloidosis occurs, it is usually because of the stimulus which any stimulus that is any which tries to alter that of the monoclonal B cell proliferation might cause the excess of the production of the immunoglobulins and even their consequently the increase in the light chains, which will cause only partial digestion, that is only partial proteolysis or the breakdown of the proteins into soluble metabolic products, and this will result in there's only partial digestion, this will result in deposition of insoluble or abnormal protein known as insoluble AL fibril. So this is the reason why the AL amyloidosis occurs. Coming to the AA type of amyloidosis, so when there's any stimulus which will cause a chronic inflammation, this chronic inflammation will in turn cause the activation of certain macrophages. And these macrophages, as they have a property of releasing the cytokines, mostly among them the cytokines, they are the interleukin 1 and 6. Once these cytokines are being released from this macrophages, they will cause the partial degradation, and because of this partial degradation, this will in turn release an amyloid enhancing factor, which usually causes or enhances the abnormal deposition of this A amyloid protein and result in a formation of insoluble amyloid associated fibril. So this is a pathogenesis for the localized, that is for the primary as well as for the secondary type of amyloidosis. Coming to the incidence level, usually we see that the primary amyloidosis is most common in the US as well as in certain other developed countries, whereas the secondary amyloidosis, we see it is usually worldwide present. And the organs which are most commonly affected with the primary amyloidosis, it is the kidney and the heart, whereas in the secondary amyloidosis, we see kidney, liver, spleen as well as certain adrenal glands can also be affected. Coming to the stains, which usually help in distinguishing the primary from the secondary, they say usually Congo red is being stained, and among the Congo red, when this stains the primary amyloidosis, we see there's persistence of this Congo red color even after the exposure with another chemical acid known as permanganate. But whereas here we see in secondary amyloidosis that this congophilia disappears, and after the potassium permanganate is being applied. So this is a major difference between the staining of the primary amyloidosis and the secondary amyloidosis. So this completes the differences of primary as well as secondary amyloidosis. Coming to the pathogenesis, why amyloidosis occurs. Usually we see that the proteins, they are formed either from the association of few amino acids which fuse together and result in a formation of fragments, or otherwise proteins can also be formed directly by the fusion of these fragments which has been formed by the amino acids. So this is usually the normal formation of the proteins, how it occurs. Coming to the what happens in amyloidosis and what is the pathological basis or the reason why this abnormal protein deposition occurs is usually there's flip-flopping of the certain type of protein types we see in amyloidosis occurring. Usually when there's any stimulus or when there's any disturbances during the sequence of amyloid formation, it might result in misfolding of these proteins. So this misfolding of the proteins will result in proteolysis, that is it breaks down the protein, that is proteolysis. If we split the word proteolysis, it means protein breakdown, lysis means breakdown. So this will result in undissolved misfolded proteins. So when this misfolded proteins are being broken down, it results in certain metabolic certain byproducts which are the undissolved misfolded proteins. This undissolved misfolded proteins, they have a property to fuse together, where the hydrophilic ends, that is the water soluble ends, are at the periphery, and the water insoluble ends, that is the hydrophobic part, they are present at the center. Because of this hydrophobic parts present in the center, they are not being dissolved by the water soluble solutions, and because of this they become more and more stabilized with the help of another matrix proteins known as glycosaminoglycans, otherwise serum associated serum amyloid proteins. So both of them together, they help in stabilization of this hydrophobic aggregates, and this hydrophobic aggregates in turn fuse more and more and result in a formation of oligomers. This hydrophobic aggregates together, when they result in a formation of a ball-like fashion, they are known as oligomers, and this oligomers they result in a formation of amyloid fibrils, that is which are undissolved protein metabolites which have not been dissolved, and this results in abnormal deposition of this kind of proteins. So this is the reason why there's extracellular deposition of the proteins, and this condition leads to amyloidosis. Coming to the signs and symptoms, usually since amyloidosis occurs anywhere in the body, it is broadly or widely it is being distributed. So based on particular locations, there are certain manifestations. Coming to kidney, we see usually there's there's hyperproteinemia, that is increase in the protein content, that is abnormal protein content, and there's mostly we see associated in conditions such as chronic renal failure. It might result in abnormal accumulation of the proteins resulting in hyperproteinemia anemia and cause a condition known as nephrotic syndrome. Usually we see that and this is being associated with the glomeruli as well as from the tubules. Usually this amyloid protein, they are being filtered from the blood through the basement membrane which is present in the blood capillaries. From there it is being drained into the extracellular space. So this is what is the general filtration process of any kind of proteins, whether it's an amyloid protein or any other proteins in the body. But we see here that this proteins here in the glomeruli, they pass to that of the basement membrane which is present in the glomeruli. From there they reach within the lumen of the glomeruli, and there they start accumulating and start enlarging the glomeruli. So this is what we see in case of the part which is being associated with kidney. Coming to the next part, it is the tubular part. In the tubule we see similarly at the wall of the tubule these proteins are being deposited. From there they reach the intertubular substance, and there from the they reach the extracellular part and cause the narrowing of the tubule as well as cause an abnormal deposition. This results in a nephrotic kind of syndrome. And coming to the gross section, when we see usually the kidney, it might be normal or otherwise enlarged, and the cut section, it shows a waxy as well as translucent kind of appearance which might appear even pale sometimes. So this is what we see when it is associated with the amyloidosis is being associated with the kidney. Next, coming to the heart, usually we see in cases of atrial fibrillation or otherwise arrhythmias which can be associated, and this abnormal deposition of this amyloid under a microscopical view, we can see that there is pressure atrophy because of this abnormal deposition of this amyloid protein, which causes the atrophy of the myocardial fibers can be seen. And other than that, there is also alteration in the diastolic as well as systolic heart rhythms which might result in a heart failure. Coming to the liver part, usually we see in case of liver, the gross section, it gives when we see it's a cut, it gives it could be show liver enlargement, that is hepatomegaly can be seen. Other than that, we also see the cut section shows pale white. With that, there's even accumulation accumulation of amyloid gives a waxy-like substance. Since it's amyloid proteins gives a starch-like constituent, it gives a waxy and translucent appearance. And usually the amyloids in the liver, they are usually deposited in the space of Deci. This space of Deci is a particular space which is present between the hepatocytes as well as between the sinusoids which separate these hepatocells. That is the liver cells which separate this hepatocytes. So usually we see in this area that there's accumulation of this amyloid protein. Because of the excess accumulation of the amyloid protein, this might result in the decrease in the size of the liver cells, that is the hepatocytes, and they, under a microscopical view, we see that there is these hepatocytes, they are shrunken as well as there is atrophy of this hepatocytes can be seen. Coming to the blood vessels, usually we see since blood is being drained from the blood through the basement membrane of the blood wall capillaries and from then into the extracellular space. So we see that they might cause damage in between the intercellular spaces which is present between the endothelium, because of which there is more as amyloid deposition, and because of this gives an appearance of raccoon eyes when seen microscopically. Coming to the tongue, usually amyloidosis can occur anywhere from the gastrointestinal cavity to the anal area. So it can involve any part of the area from this region. And most commonly when it involves the tongue, we see there's abnormal deposition of this protein gives increases the proteins and causes increase in the size of the tongue, and this condition is known as macroglossia. Coming to a next condition, when it's associated with the spleen, we can see two types of conditions. One is the sago spleen and one is the Lardischer spleen. Usually in the sago spleen, we see that the gross specimen of the sago spleen shows presence of numerous amyloid nodules which appear as a sago grains, because of which it is being termed as sago spleen. And in this sago spleen, when we see at the microscopic level, usually we see that most commonly it is a white pulp area of the blood vessels within the spleen which is being affected with this amyloid deposition of the proteins. And coming to the Lardischer spleen, it is so called Lardischer because lard here means it probably resembles in a gross specimen as that of the fat of a pig, because of which it is being termed as Lardischer spleen. In Lardischer spleen, usually we see that the splenic sinuses of the red pulp of the splenic sinuses show this presence of amyloid deposition of the protein. So these are the certain signs and symptoms which are being seen associated with the amyloidosis. So these are the certain pictures, typically the pictures which show that of the amyloidosis, where we can see hyperpigmentation of the patient, and as well as hyperpigmented macules can also be seen in the lower leg areas, as well as in the backward and the waist, as well as in the individual blisters can be seen associated with the upper arm. Coming to the staining characteristics of amyloid, usually previously it was what was done was that when a gross specimen has been arrived to a pathology lab, then this specimen was directly stained with certain dyes known as Lugol's iodus, and one such kind of stain where the presence of amyloid, this presence of amyloid would probably give a particular brown color to that of the this gross specimen, and based on that it would have been diagnosed as the patient is suffering from amyloidosis. But since there are certain advanced methods of staining even based at the tissue level, so they have been particularly presently the stains which are being used, amongst them one of them is hematoxylin and eosin stain. Usually this is a stain which is used when an amyloid tissue which is being stained with this hematoxylin and eosin. It has been observed that it gives a particular homogeneous and eosinophilic kind of hyaline kind of appearance when it was viewed under the microscope. Coming to another group of stains, they are the metachromatic stains. They are so called metachromatic because they do not usually impart the color which has been used to stain actually. So because of this, the stain they give an other color, so because of which it is shows it is termed as metachromatic, that is different stain. Among the metachromatic stain, they are most commonly the rose aniline dyes which are being used, and these rose aniline dyes, they are the crystal violet or the methyl violet can be used, and they usually give a pink, reddish pink appearance when being stained. Coming to another type, the Congo red, which is the most commonly used and most commonly characteristic feature of an amyloidosis. When it is being stained with this Congo red, it usually gives a red-pink color, and when viewed under a polarized light, it usually amyloid tissue, it gives apple green birefringence color can be observed, which is one of the characteristic feature for amyloidosis to be diagnosed. Coming to the fluorescent stains, usually among the fluorescent stain, most commonly preferred one is a theophlavin T. This theophlavin T usually has a property of binding to that of the amyloid tissue, and then it gives a yellow fluorescence when viewed under the polarized light of fluorescent microscope. So this is one of the stain. And another advanced molecular level based diagnostic aid, it is the immunohistochemistry. There have been certain antibodies which usually have a property to go and bind to this amyloid protein antigen in the tissue, and among them it could these antibodies, they are the antigen antibody AA type or antibody AL type. These are certain antibodies which have been used at the immunohistochemical level. Coming to another non-specific stains, they are the Toledan blue, which usually imparts blue color, purple blue color, and Alcian blue, which also imparts a blue-green color to the amyloid tissue. And periodic acid skip stain, it is usually a stain which is usually done to diagnose that the amyloid consists of the carbohydrate content, and because to diagnose the presence of glycogen content within this amyloid. And because since amyloid has this starch type of content, it stains positive for the periodic acid skip stain. So these are certain stains which can be used to diagnose the presence of amyloid in any tissues. Coming to the diagnosis of amyloidosis, so usually it is mostly based at the tissue level, that is a gross specimen has to be sent, and this gross specimen has to be further processed to observe and it has to be prepared to observe under a microscopic level and stained with particular preferred stain which gives a positive stain for amyloidosis, and thereby a diagnosis can be given. Other than that, it can also be done in the patient. When it is being done in the patient, it is known as in vivo. In vivo Congo red test can be done, where the patient will be injected with this Congo red dye intravenously, and when since it has an affinity to bind, when the blood levels are being examined, we see there is rapid decline in the blood levels, because of which it can be said positive for presence of amyloidosis. Coming to another test, they are the protein electrophoresis, where we see that the protein macromolecules they are being subdivided or being separated based on the molecular size, and this helps in diagnosing the abnormality in the protein. And immunoelectrophoresis, we see that this is majorly done to identify that based at the immunoglobulin level, that where immunoglobulin mu, alpha as well as delta immunoglobulins can be identified, and based on this it can be suggested as what type of amyloidosis it is. And the other kind of diagnostic methods can be also made on bone marrow aspiration, since heredofamilial kinds of group, they show mutations from the basic level as well as even at the immunoglobulin level we can also be seen. In case of AL type of amyloidosis, of primary amyloidosis, bone marrow aspiration can be also one of the diagnostic aid. So coming to the pictures, here we can see that is, we see there is a first picture showing a cardiac tissue which is being stained with hematoxylin and eosin, which shows eosinophilic areas, and they also show hyalinized type of areas, which is a characteristic feature of amyloidosis when stained by hematoxylin and eosin. The next picture shows the duodenum amyloidosis deposition, where we see that it is also being stained with H&E stain, and we see that the amyloid, it is being seen around the blood vessels properly. And coming to the next picture, it is the amyloidosis being stained with the Congo red. The amyloid deposits, they are strongly congophilic when they are viewed before the white light. So there is a picture, first picture which can show help us the presence of Congo red color. The next one, the next picture stained with H&E, showing the amyloidosis around the blood vessels. So there is a picture showing the apple green birefringence when seen under a polarized light.